the channels of the arm. Okay, now, there are different ideas about direction and stuff like that. Okay, for the purposes of this routine, we're looking at it more like musculoskeletally. Like if you
venous flow, or
I'm gonna go proximal to distal. It's because okay, if you have any kind of problem in the arm, like whether it's like the elbow or the wrist, like carpal tunnel or something like that, the reason why I like to start from the trunk and then move my way outward is that if you have a problem here, it could be caused by some kind of obstruction or something going on upstream. So it's to me it's a better strategy to release from the trunk and then just progressively get to the problem area instead of trying to work on the problem area and working backward this way. At least this way, hopefully by the time you get to, like, if she has carpal tunnel, by the time you get here, you'll have released everything along the way, so that this will have been will have released as much as possible. So anyway, that's the idea behind it.
I'll be shoving that and everything in front of it up to the heart.
Yeah. So for the lung channel, we put the arm in this position, maybe about 20 or 30 degrees away from the body. And we can just start off with like the rubbing, Just rubbing. Okay. Sometimes when the table is narrow and you have the patient's arm hanging off like this, I think it's alright, but especially as we start to get more to the pericardium channel, things like that, it might be necessary to support the arm. And then you can just start off with some palm pressing. Just like on the leg, don't put direct pressure right on the elbow. Because especially if their arm is hanging off the table like this, if you put pressure, like you might hyperextend the elbow or something like that. So I kind of bypass the elbow and just put palm pressure going down this way. And then I go right into putting more focused pressure onto the points of the channel. So you can use whatever you want to, whether it's your finger or your knuckles. Yeah, I prefer to use the thumbs. Okay. So I'm starting at lung 1. Again, if you're not sure about points, just kind of try to follow the general line of the channel. But lung 1 actually starts off, if you feel for the clavicle, if you follow the clavicle to the lateral edge, you'll find like a kind of a dip there, and it's kind of in the triangle between the clavicle and the deltoid muscle and the pectorals. That's actually lung 2. So lung 1 is a little bit below that. So you can just start off at lung 1, putting pressure, and you can do some kneading with that pressure. I'm just making small circles. So lung 1, lung 2 again is in that depression. And then the lung channel, again, it's kind of on the thumb side of the arm. So with regards to the upper arm, you can kind of feel where the biceps muscle is. You're gonna go just lateral to that and continue on down the line. And you don't have, you can just try to make it like a continuous line. You don't have, the lung channel actually has a lot of big skips in it, like skips a lot of distance, but you can just work to maintain the, like it's one solid line. So lung 5 is going to be just on the thumb side of this, the biceps tendon right here. You might find it easier to switch hands, like, notice like I was holding her wrist with my right hand. I work the upper arm with my left. And if you want, you can just continue with your left hand, but sometimes it feels easier to switch at the elbow and just continue on down this way. So lung 9 is right at the wrist. And then you go on to the hand. So this is the thenar eminence, this big kind of fleshy part below the thumb. So lung 10 is, you can just work on the middle of that thenar eminence right here. And then lung 11 is on the thumb. You can't, in this position you can't just you can support the thumb and put pressure on it, but usually I just kind of glide over it. Okay, in this position. Okay, after that then, sorry, I'm going to go on this side, but it's good to go into more like the grasping techniques. You can try to make it specific to the lung channel, but grasping techniques by nature are more like larger. You can do grasping, you can do more grabbing, or even nipping. Okay? But try to feel the shape of the tissue that you're working on. If you feel anything that seems hard, I don't really feel anything distinct. Then you can, try to focus more on it with, again, more kneading, whatever. Yeah. I like to. In the notes I put down that we can also do pushing. It can be kind of difficult at certain places. Okay, so I'm just gonna. Okay, I'm gonna push more on the lower arm, from the elbow down. So, you can use your thumbs or your fingers. I'm going to use my fingers for this. So I start from like lung 5, and then I just push along the channel, going out towards the hand. It gets harder as you get to narrower or bonier areas. Use my thumb the same way, trying to maintain that line. Okay, so that's working on the lung channel.